guys, it's me, Dr. Samina Rahman, Gyno Girl, coming to you from downtown Chicago. Again, I wanted to talk to you today about the use of vaginal estrogen, not specifically why it's important, but just fundamentally which ones are available and which ones you might want to use. So specifically, which vaginal estrogen might be right for you. And that's what I'm going to delve into a little bit today. So let's get at it. Okay guys, again, my name is Dr. Samina Rahman. Gyno Girl is what I am referred to as. I'm a board certified gynecologist in downtown Chicago. I have my own private practice and I specialize in menopause care as well as vulvovaginal health and sexual medicine. And today we're going to get into the nitty-gritty about which vaginal estrogen might be right for you. I had a video about how vaginal estrogen can save your life, and we've also discussed the genitourinary syndrome of menopause. So just a quick little review. There's certain times in your life where you might be hormonally deprived. Actually, I was at the International Society for the Study of Women's Sexual Health faculty course last week where I was helping to teach about this. And the one thing that all of us had agreed upon is that it should really be called the genitourinary syndrome of hormone deficiency. And that is because there are many times in your life where you might be hormonally deficient and have these symptoms. Menopause and perimenopause is definitely one of them. When you lose 50% of your testosterone and you're no longer making your own estrogen, the vulvar and vaginal changes can occur. Here's what histologically happens in the vagina. The connective tissue decreases, the vaginal tissue becomes thinner, the collagen decreases. So we know that happens, okay? As well as the external vulva changes. Again, the clitoris shrinks, the vulva shrinks, the labia minora shrinks, the vestibule, remember the vulvar vestibule, and I'm not in my office or I would show you my vulva puppet again, but because it has estrogen and androgen receptors, it's important for those hormones are very important for the vestibule, and it keeps the vestibule very healthy. And so when you lose those hormones for different periods of times in your life, specifically peri and post-menopause, the tissue becomes thin and red, and your urethra can change and your bladder can change. And this leads to painful intercourse. It leads to pain on initial insertion. It leads to pain on deep penetration sometimes because of the lack of lubrication. It can lead to vaginal dryness. It can lead to vulvar pain and diminished orgasms, clitoral issues, the works. But mainly the genitourinary syndrome of menopause or hormone deficiency is around vaginal dryness, vaginal pain, vulvar pain, sexual pain, urinary frequency, urinary urgency, and recurrent UTIs. And the use of vaginal estrogen can prevent all of this. It doesn't increase your systemic levels, and so it's very safe for most patients. And so there are these different forms that we're going to talk about, and the best form is the one that you can take and that you can afford, right? So if you get prescribed something that you either can't afford or can't take every day because it's, multiple reasons, then you need to find something else that you can take. So the first and the sort of most basic one is vaginal estrogen in the form of a cream, and sometimes it's known as estradiol cream or Premarin. And it is a cream that you apply. You use an applicator, you push it in the vagina, and then you can apply it to the external vestibule too. So that's kind of a benefit in that respect. I think is one of the cheaper forms of vaginal estrogen. If you look at a Good RI, which is an app that you can look up to see what coupons you can use, as well as Mark Cuban's pharmacy called Cost Plus, you can find some cheaper versions that might be more affordable depending on what you can get. So there's estrogen in the form of the cream, and that's what you're going to put inside the vagina. Use it every night for 2 weeks and then twice a week until death do you part, because it is a chronic progressive condition that gets worse with time if you do not use the estrogen, and you're not going to all of a sudden start making that back. And even when you're using systemic estrogen in the form of a patch or a pill, it oftentimes is not enough. So that's the cream. That's the estrase cream. That's the estradiol cream generic. I think it is $22 at Mark Cuban's Cost Plus. I was just looking it up online. There is a tablet that you can put in the vagina, the Uvafem, Vagifem, and it comes preloaded in an applicator, if you can see this picture here. And it is very beneficial for some patients because it's preloaded, you push it in, and you're all good with that. I think at Mark Cuban's pharmacy, it is, the vaginal insert is, it's not that cheap, it's 113 bucks. So there's that. The reason why a lot of patients don't like the cream is that it can get messy. The reason why a lot of patients don't like the pill is that it comes in a preloaded applicator. Many patients feel like it's a big waste for the environment. If you think you have to use it every day for 2 weeks, then twice a day till the end of your life, because the symptoms will recur and it becomes progressive and it's chronic. That's like something like 3,500 applicators between the ages of 50 and 90. So it's a lot. And you can't apply it to the vestibule. So that's kind of one of these things where people don't always like that. And that, I think the brand name is estradiol pill as Uvafem, Vagifem. There's the estradiol soft gel. Its brand name is Imvexi. Just to clarify, I have no affiliation with any of these pharmaceutical companies, no financial affiliation. So soft is a soft gel tablet. It's a soft gel pill, actually. You can see here, it's called Imvexi. The bonus around it is that it has a bioadhesive coconut oil that gives a little extra lube. So it's probably my second favorite. It comes in 2 doses, 4 micrograms and 10 micrograms. So if you're a little hesitant, at least you could get the little bit of that. Again, every night for 2 weeks and then till the end. Pro tip is that you can use Blink Pharmacy, which is a specialty pharmacy, and you can sometimes get it for cheaper because all the coupons are applied. It's much more accessible than it used to be years ago. So that is Imvexi, or the estradiol soft gel. There is the estrogen ring, which is a 2 milligram vaginal ring. This is really good for my patients who need convenience, who might forget, the twice a week till the end, who can't actually do something vaginally all the time. And so sometimes for even my older patients that can't get in there, they'll come to my office every 3 months and I'll put it in for them because it lasts for 3 months. And so it's nice that it's a gel, it's a ring that you can kind of squeeze in, you put it in. It might be a little difficult for patients that have prolapse, so that is of concern. And I think on Mark Cuban's, a couple $100. And so that is good for those patients for that reason. The next one I want to talk about is actually not vaginal estrogen, but it's a DHEA, which is a precursor to both estrogen and testosterone. This is probably my favorite. If I could put it in the water for patients, I would. I actually use it myself. It comes in these vaginal inserts. It's prosterone, or Intra Rosa is the brand name, and you can see how it comes like this. It does have applicators you can use, but you can just put it into the vagina. It converts into estrogen and testosterone in the vagina. Some of it leaks into the vestibule. This study that was just published a couple months ago by the godfather and godmother of sexual medicine, Irwin and Susan Goldstein, showed that the vestibular changes happen with Intra Rosa as well. So the DHEA gets converted into estrogen and testosterone, the vestibule and the vagina. So it's great that way because we know we have receptors for both in both the vagina and the vestibule. So that is called vaginal DHEA, or Intra Rosa by the brand name. It is difficult sometimes for patients. It has to be refrigerated. It's every night actually, not so. And for the patients that might forget, Monday, Thursday insertion of vaginal estrogen, you actually have to use this every night. The downside is you can't get it for $35 a month with a coupon if your insurance covers it. If it doesn't, it's like $85 at Costco. So again, vaginal DHEA at 6.5 milligrams. You can use an applicator, and it's very helpful to both. And then the last real type of vaginal estrogen offering that I can give you is called espemifene, and it is the only form of estrogen that you take orally that actually goes into the vagina, and it's approved for genitourinary syndrome of menopause. It is 60 milligrams daily that you could take. It's oral. It is one of those selective estrogen receptor modulators, which means that it is similar to the tamoxifen, the raloxifenes, that modulates differently in different tissues. So at the level of the breast, it's actually anti-estrogenic, although not approved for breast cancer patients as it wasn't studied. But sometimes if you want to talk to the oncologist to use it off-label, possibly. Again, everyone is case-to-case basis. It's the only oral form, so for people that don't want to stick anything down there, it's great. So a couple of side effects, you can get some vasomotor symptoms, the hot flashes, the night sweats in less than 10% of people. You might get a little spotting. It's weakly activating on the endometrium, but no cases of endometrial cancer have been seen with this. And because it's a selective estrogen receptor modulator, it has the risk, and it goes orally metabolized through your liver. It does have that small risk of DVT risk, or it's at least on the black box warning. And so, the key points that I want to make with those, so that's ospemifene oral form. If your genitourinary symptoms do not improve within 2 months, you have to make sure that you're taking it appropriately and that it's something that you can use, right? Like, if it's not going to work if you cannot use it the way you need to use it and that it's been studied. And you have to use it even if you are taking systemic. Most of the time you have to use it even if you're taking systemic estrogen or progesterone or testosterone. We have to make sure that the best of all of these is the ones that you can afford and the ones that you can use. So again, compliance is key. So whatever can make you the most compliant. Again, it's a chronic progressive disease. When you have that superficial vestibular pain or that superficial dyspareunia and you're using something like maybe the estradiol pill that goes all the way up into the vagina, or the oral ospemifene, sometimes you need to use a little bit of estrogen and testosterone for that hormonally mediated vestibulodynia that I've spoken about before, and that's at the opening of the vestibule. And so you can talk to your doctor about that if you're not getting appropriate help when it comes to pain with sex. And the last point I want to make is when you have pain with sex and it starts to hurt all the time, your natural reaction is going to be to tense up and the pelvic floor becomes hypertonic. We did a great episode with my pelvic floor therapist before. You might develop vaginismus, where you have an anxiety reaction of your pelvic floor. So as a result, people will also many times need concurrent pelvic floor therapy, which, there are many great therapists that work with my patients to reduce the pain that they're having, to release the muscles, and to help them have better intercourse and more control over their urinary symptoms. And remember, the last thing again is that these symptoms are not just of the vagina and vaginal dryness and sexual pain. We have a big issue with urinary tract infections in the peri and postmenopausal patients. And so urinary tract infections do kill patients because it can lead to urosepsis. So again, this medication can be life-saving for many women. And then just also remember that, hormones do make a big difference in your life. And so even if it's not perimenopause or postmenopause, there are infertility treatments that can cause the symptoms. There's some patients that do oral contraceptives will have these symptoms. Some patients that are breastfeeding and they get this lactational, what we call amenorrhea, or they're not menstruating when they're breastfeeding, can have these symptoms. Patients that have lost their ovaries to surgery or they're breast cancer survivors using medications, they can all have these symptoms. So again, that's why we like to call it the genitourinary syndrome of hormone deficiency. So there you have it. You got the ring, you got the pill, you got the oral pill, you got the vaginal pill, the DHEA, which I think is amazing, and I would put in the water if I could. And you have the vaginal creams. So those are sort of the list again of vaginal estrogens, and which one is right for you, again, is going to be a matter of what your insurance covers and what you can be compliant with, because again, it is a chronic progressive disease. So that's it. That's all I wanted to say about vaginal estrogen. Again, my name again, Dr. Smina Rahman, Gyno Girl. Please like and subscribe, and I'll see you guys later. Take care.